All right. Good morning, everybody. It is 9:05, so why don't we begin? I think we'll be recording this. Let me just confirm.
Yes, I just started the recording
Oh,
and it
perfect.
looks it looks like it is actively recording right now.
Okay, great. Um, all right. Well, good morning, everyone. We are ready to convene our hearing on the proposed repeal and replacement of Rules 7.27.2, licensing of emergency medical services personnel, 7.27.4, Emergency Medical Services Fund Act, 7.27.5, Certification of Air Ambulance, 7.27.6, Emergency Medical Services Advanced Directives, and 7.27.11, Supplemental Licensing Provisions. My name is Jared Najjar, and I'm the appointed hearing officer for this matter. This hearing is open to any interested member of the public. Additionally, interested parties were given the opportunity to submit written comments concerning the proposed repeal and replacement via U.S. mail and email. I have received a handful. I've gone through a number of them, and pursuant to the notice of public hearing, written comments must be received by the close of today's hearing. The purpose of today's hearing is to receive public comment regarding the repeal and replacement of the rules that I just mentioned to satisfy the department's regulatory obligations pursuant to the Emergency Medical Services Act and the Emergency Medical Services Fund Act. The legal authority authorizing the proposed repeal and replacement of the rule by the department may be found at subsection E of section 9-7-6, New Mexico statutes annotated, and the Emergency Medical Services Act subsections A, H, and I, and the Emergency Medical Services Fund Act. This hearing is being conducted via Microsoft Teams and it's being recorded. I'm assuming that everyone participating today has a copy of the proposed repeal and replacements. They were made available on the department's website as reflected in the notice. After my opening remarks, counsel for the department will give a brief introduction on the proposed rules and introduce the department's exhibits. Then counsel for the department can call on any department staff to make any remarks that are relevant. Following the comments by department staff, members of the public will be offered another opportunity to provide comments here today. I am mostly going to have my camera off if the bandwidth is a little shaky on our end. If it's not, I'll keep it on and I'll probably remain on mute, but I am listening and taking notes. Anyone wishing to provide comment here today may do so, but just by raising your hand in the little chat function at the designated time. I'd ask that everybody try not to be repetitive and just limit your comments to the subject of today's hearing. And with that, I'd like to turn to counsel for the department, Mr. Woodward. You may proceed.
Yes, thank you. My name is Chris Woodward. I'm the acting general counsel for the New Mexico Department of Health. And if it would be all right, I think what I would like to do is to introduce the exhibits for today's hearing, to go over those. And once those are introduced, I'll ask the hearing officer to admit those into the record. And then once we've got the exhibits admitted, I think I'll call on the EMS Bureau Chief Kyle Thornton, who is here with us today, to talk a little bit about some of the changes that are being proposed in the rules today. So without further ado, the department has, let's see, there are a total of, I think, 24 exhibits that I'll try to briefly run through here. And all of these exhibits are available on the Department of Health's rules webpage. So if you go to Google and if you do a search for NMDOH rules, that'll take you to the Department of Health's Rules and Regulations webpage, and this should be at the top there. All of the exhibits should be available there, and you can also get them on the New Mexico Sunshine Portal rules website. And if you do a Google search for the expression NM Sunshine Portal Rule Hearing Search, that seems to be the best search to get you the best result. So you just click on the first option that comes up there. So without further ado, I'll share my screen here, and I'll try not to scroll too much because I realize that can be a little dizzying on these web conferences. So This is a PDF document that's available on the DOH Rules webpage and on the Sunshine portal that combines all of the various exhibits. And so the first exhibit, exhibit number 1, this is 7.27.2. This is the clean copy of the proposed replacement rule. So this is the entirety of the rule licensing of emergency medical services personnel that includes all of the proposed changes. Exhibit 2 is a proposed repeal statement, and we just included this for the record. This is a repeal statement that is required to be submitted along with the finished rule when it is submitted to records and archives. And so obviously this is missing dates and so forth, but those things will be plugged in when the time comes. Exhibit 3 is a tracked changes version of this same rule. So this is basically a comparison copy that compares the existing Rule 7.27.2 with the modified version at Exhibit 1. Exhibit 4 is a document that was generated by the EMS Bureau. It's basically just a quick summary of some of the major changes that were being proposed in this rule. We don't have these for all of the proposed rule changes, just for the ones that had lots of changes in them. But I'll introduce each one as we go along. Exhibit 5 is the clean version of 7.27.4 NMAC. This is the Emergency Medical Services Fund Act rule. And so again, this is the proposed replacement rule. Exhibit 6 is the repeal statement that would be filed with this when it is filed with Records and Archives for publication. Exhibit 7 is, once again, the track changes version that compares the existing 7.27.4 with the proposed version. And so this shows everything that's been deleted or added or removed or moved. Exhibit 8 is, once again, the EMS Bureau's quick summary of some of the major substantive changes that are proposed to this rule. Exhibit 9 is the clean version of 7.27.5, the certification of air ambulance rule. So this is the entirety of the proposed replacement for this rule. Exhibit 10 is, once again, the repeal statement that would be filed with Records and Archives when the rule is filed. Exhibit 11 is the track changes comparison copy that once again shows all of the proposed edits to 7.27.5 NMAC. Exhibit 12 is 7.27.6 NMAC, the Emergency Medical Services Advanced Directives rule. There were a few changes being proposed to this. And so this is the clean version of all of the proposed changes to that rule. Exhibit 13 is, once again, the repeal statement for this rule. Exhibit 14 is the tracked changes version of 7.27.6 NMAC that records all of the proposed changes to it. Exhibit 15 is 7.27.11 NMAC. This is entitled Supplemental Licensing Provisions. This is essentially the scopes of practice rule for EMTs. And this is the entire proposed replacement for that rule. Exhibit 16 is the repeal statement. Exhibit 17 is the track changes comparison copy to show all the changes that are being proposed to this rule. Exhibit 18 is the EMS Bureau's quick summary on some of the major substantive changes that are being proposed to this rule. Exhibit 19 is the notice of public hearing. So this is the notice for today's hearing that was published in the Albuquerque Journal and in the New Mexico Register. Exhibit 20 is the affidavit of publication of the preceding notice. This is an affidavit from the Albuquerque Journal attesting that the notice of hearing was published on May 6th of this year in the Albuquerque Journal. Exhibit 21 is the affidavit of publication in the New Mexico Register, which also attests that this was published on May 6th of this year in the New Mexico Register. Exhibit 22 is the letter appointing the hearing officer in today's hearing, Mr. Jared Najjar. And Exhibit 23 is an affidavit of notice to the public that was completed by Stephanie Lopez of our Office of General Counsel, attesting to various notices that were given, copies that were emailed, and so forth. This affidavit is included essentially just to demonstrate that and to include in the record a statement as to the efforts that were taken to comply with the State Rules Act. And Exhibit 23, which is not included in this document, is reserved for all of the written public comment. And so those written public comments should all be available on the New Mexico Department of Health website, the rules website that I mentioned earlier, as well as the Sunshine Portal. And as the hearing officer mentioned, the agency will be receiving written public comment through the close of today's hearing, and those can be sent to the address identified on the notice of hearing that I mentioned earlier. And so with that, that is all of the department's proposed exhibits. And so at this time, I would ask that the hearing officer admit these exhibits 1 through 24 into the record of today's hearing and allow the department to supplement that record with any subsequent written comments that we may receive by the end of today's hearing.
All right, thank you very much. Exhibits 1 through 24 are admitted into the record, keeping in mind that Exhibit 24 may be supplemented as additional comments are received.
Thank you. And so at this time, I would like to turn it over to Kyle Thornton. Mr. Thornton is the Bureau Chief for the Emergency Medical Systems Bureau within the Department of Health. And Kyle's going to talk with us about some of the changes that are being proposed in the hearings, in the proposed rules today.
Great.
Good morning, everyone. Oh, sorry. Hearing officer, sorry about that.
No, go ahead.
Good morning, everyone. It's great to see the names and the folks here. I am Kyle Thornton. I'm the Emergency Medical Systems Bureau Chief. I will be going over the major changes to the rule. I'm going to use a PowerPoint to kind of keep me on track, and I will share my screen in a moment if that's okay. We'll go through the rule, and I assume, hearing officer, that you want me to go through the whole rule and then allow comments, or at different times throughout, or however you want to do that, sir?
You can just go ahead and present. If Mr. Woodward has any comments throughout your presentation, that's fine. Otherwise, the floor is yours.
I think that sounds appropriate. I think what we'll do is Kyle, if you'll give your presentation, and then once you're done with your presentation, the hearing officer can open things up for public comment, and we'll call on people individually. So if the folks who are on the call have questions about any particular item that Mr. Thornton presents here, I would just suggest that you make a note of it, and then we can get to your comment here in a little bit.
All right. Well, I am going to share my screen here and get this figured out. Hopefully you are seeing 7.27.2.
Yes.
All right. All right. And I am going to disappear here. Okay. Again, I'm just going to go through and hit the substantive changes that are listed. And starting off on number 1, we are not proceeding with the proposed EMS RN. And so all references to the EMS RN in licensing rule or air rule or any other rule will be removed prior to submitting to records and archives. So that part of the proposal is not going to be discussed and will be removed. With that, on page 3 of the licensing rule, I just wanted to reiterate that we will be removing that and discussing that proposal somewhere down the line. So that makes me jump up to page 8. And sorry, no, that's not fun. Page 8, we start off with clarifying and simplifying the length of licensure, and the with the idea there of, sorry folks, there we go. And catching up myself. All right. With discussing the length of licensure, how long the license lasts. It was a little bit confusing how that was described previously. Some of you remember that if you get a license at one particular time of the year, it expires at a different time of the year, or 2 years later, 2.5 years. So we tried to make that a little more clear on the top of page 8. Again, anything regarding EMS RN is going away. A little bit of a discussion there of a graduate license and how that will work. If that it is not allowable that you can just go from graduate to a full licensure. A couple of other minor comments there. And for page 9, simply a couple of additions to clarify that an agency needs to have and be able to show medical direction if there are folks that are coming in from other areas to help us, say with the fires or something like that. This is generally refers to emergency recognition. And we just want those entities that are coming into our state to help us to make sure and show that they do have medical direction in their home state. Now, on to page 10. And page 10, the major change here, you can see some grammatical changes, but the major change here is that for the first responder level, the state exam the state will now accept the classroom exam as a state final, a state licensing exam. We have the discretion to do that. It is only for the EMS first responder. Many of you remember that we switched from that process, that practice, to using the National Registry for EMS first responder. I think that's been primarily a failed experiment, and I think we've lost a good number of applicants. So I'm hoping that this re-energizes and reinvigorates that level of class and licensure. So that's the big part of page 10. All right, moving on. There we go. Skimming past page 11, simply because that references primarily EMS RN. Again, all of that will be deleted prior to submission. So going into the bottom of page 11 and page 12, basically grammatical additions and little corrections of language and numbering and that sort of thing. So not too much going on there. And then page 12, the primary change on this, other than some grammatical and language corrections, is we're received a ton of feedback over the years that the process that we have for reciprocity has been hindering to folks coming in from out of state. those that are trying to get a job here or do have a job, have applied for and been hired. But to license here, they have to go through a process. If they're a basic or intermediate, they have to do a transition class, as many of you remember, and then take a state exam in addition to all the other licensing application tasks. And if you're a paramedic, there's no transition class, but you still have to take the state exam. There was a lot of feedback over the years that has been a hindering prospect of getting folks from out of state hired. The statewide EMS advisory came up and suggested language that would, in certain situations, allow for a bit of an expediting of that process. And what that is at the bottom of page 12, that if a person has been hired from out of state and they have a job waiting for them, that in lieu of taking a state exam, they can be attested to by that particular agency's leadership and that particular agency's medical director. And if that person can show the support of that agency, then they will not have to take the reciprocity exam. It is purely an option on the part of the agency and the medical director or agency leadership. And if they don't want to do that, or if they're uncomfortable, then the person just goes through the normal process. So I just, again, in response to the statewide advisory's input and request, we've included this, and it's part of the proposals. All right, down to page 14. As we go past, you'll see not many changes to 13, there's some language. All right, down to page 14. One of the major change on here, at least in the top portion, is we are moving the renewal, not the renewal deadline. Sorry about that. This is a typo on my own part. We are changing the date of when you can complete your CEs until March 31st. And so your renewal will be due on March 31st, as always, but you will be able to do CEs all the way up to March 31st to match the National Registry and their timing. Yes.
I just have a quick question regarding CE. I assume it means continuing education credits, but I just want to clarify.
I apologize. Indeed.
Okay.
Continuing education. Yeah. So wanted to mention that. Further down on page 14, we clarified what inactive or limited scope means, just to make sure that that is understood. And that's the addition there at the for the rest of page 14.
Kyle, if I could just interject. So as I'm following along with your presentation, it looks like your page numbers are in reference to the comparison versions of these rules.
Absolutely, yes.
Okay, so I just wanted to highlight that for folks. If you're looking for the material that Mr. Thornton's referring to, it's in the sort of track changes version of the rules that are posted.
Indeed. Apologize. Didn't even think about the possibility of the other version. Sorry about that. All right. Now then, sort of went through pages 15. Most, although it looks like there's some pretty good levels of deletions. Again, most of that refers to when the deadlines for CE, continuing education completion, is due. And so again, we're getting rid of that December 31 deadline and moving it to March 31st. All right. Page 16, that discusses the renewal of the EMS RN. And again, that is not going to go forward. And so that takes us then to page 17. And what we're doing here, the primary change on page 17, is that we are clarifying the number of times somebody can apply for reciprocity. Prior to that, or this and reentry, it really wasn't clear how many times somebody could try reentry or reciprocity. And so we made clear here that the reentry process may only be attempted once. And if a candidate for reentry does not successfully complete that, then they do need to go back to full licensure course. So we just wanted to make sure of that. And again, for here, it specifically addresses reentry, just to make sure that it's clear for folks doing that. All right. Now, the rest of the pages between there and on into page 29, there's very few changes. Page 20 has reference, and along with some other pages, brief references to EMSRN. Again, reminding you that those will go away. And I'm just scanning through myself just to make sure. All right. Okay, now, all the way down to the bottom of page 28 and top of page 29, there is a little bit of, or a paragraph there that states that someone who is practicing without an active New Mexico EMS license, EMT license, that there is a fine structure that is in accordance with the Uniform Licensing Act. So we added that paragraph. Chris, if there's anything you want to add to that, that's primarily your expertise there. But
yeah, we realize that the statute is, as it's now written, requires that there be a list of all criminal offenses that could potentially disqualify an applicant. So that is more or less the list that could. It's a lengthy list, and it's a list of all of the various offenses that could potentially disqualify someone. And I should also note that up above, before that, there were some additional provisions included, and now I've lost the page, I apologize, regarding immediate suspensions. And I think that's on page 24 of the comparison document. And those changes were also incorporated in order to comport with changes in statute.
and when you say statute, you mean to the ULA, the Uniform Licensing Act, correct?
My memory is a little bit fuzzy on that. I think it was specific to the Uniform Licensing Act, yes.
Gotcha. All right. And the change that I was referencing real quick was actually the one about unlicensed activity, and the addition of a fine structure there, according to the ULA. So that's the one on page 28 and the top of page 29 that I was referencing. Then we get into page 30 and 31, where there have been updates to the hearing that Chris was just alluding to, how hearings are requested, what they're requested for, how suspensions can go. All of those things, indeed, as Chris said, have been updated to make sure that we comply with the ULA. And then the next several pages just have a few minor additions to the process of hearings, and hearing officer presentation order and different things like that. Page 34 just explains how final decisions of hearings and investigations can go. And then page 35 is how criminal history is reviewed by the EMS Bureau, and just a couple of clarifications of pleading guilty or nolo contendere to felonies and how that fits into a criminal history review. And so 39, the next several pages there don't have any particular major additions, but 39 is the beginning of the actually it starts on 36 on one copy, but what I was using, it had page 39. This is where the list begins of disqualifying offenses that Chris was just mentioning. Again, that is on page 36 of the straight red line. I apologize for that little typo there, but you'll see that it's quite an extensive list, several pages. We've never had that before, but we had to develop one, as Chris said, to make sure we comply with the ULA. So that's why that appeared there. And we'll see how it affects the process going forward. I don't anticipate having too much of a change in the process for criminal history and how it's handled, but that is why all of that was added.
Yeah, I guess the only note I would add on that, Kyle, is that that just because somebody has a conviction for one of these things doesn't mean that they're like, it's not sort of automatic that they would be disciplined by the Department of Health. It's just that in order to be disciplined by the Department of Health, EMS Bureau, for a criminal conviction, it would have to be somewhere in this list. So right. That's the significance of it.
Gotcha. All right, and that takes us to the end of the licensing rule proposals. Hearing officer, I can go right into the EMS Fund Act if you like, or whatever you would like to do at this moment.
Yeah, if you would like to keep moving, that'd be great.
Keep rolling. All right.
All right.
I'm gonna switch that real quick. What I've noticed is as I made comments to redline versions, it extended the pages of the length of the document, and that's what's being reflected on my page numbers here. So I apologize for that if there's a bit of confusion there. All right. For the EMS Fund Act rule, some of you may remember that the EMS Fund Act was updated several years ago to include particularly regionalized services and that sort of thing. And we never did get the rule updated. And now I'm kind of glad we didn't, because as most of you know, the EMS fund was very generously by the legislature given a portion of the healthcare insurance tax, and now then we'll receive an appropriation of approximately 11 million, perhaps more, per year. And so that allowed us to change the rule, or waiting until now allowed us to change the rule to better meet that level of funding. And so then we're just kind of going through that and making some changes there. All right. Now, on page 1, primarily there's no major substantive changes to the rule, updating dates and correcting language and issues like that. Page 2, we did amend the definition of a local recipient to match the language of the act of the statute itself, with defining regionalized agency. So they now are in concurrence. There's the definition regionalized, and they were relocated in the list just to make them correct in their alphabetical order. There were several times throughout the document, you'll see references to online, changing the application process to online. So that's just modernizing the rule to match what we're doing. And again, there's some always going to be some, anytime we need to updating to include regionalized agency. All right. We also began or started updating the startup and entry-level funding, again, because of that, the generous appropriation that the EMS fund will be receiving now. And then obviously, again, modernizing that language, and then updating some of the standards and requirements for startup and entry-level funding. A stand ready level was included for the first time. The stand ready level is basically there's agencies that don't run a lot of calls, and but they need to be prepared to do so. And so this level was created for those entities that are doing the education and meeting all the standard, but not running a number of calls. And so that was added to be able to continue supporting them. Updating the amount of the first responder level, as well as the standards for receiving those fundings, updating amounts for the basic medical rescue and updating those standards. And then you'll see probably a few times throughout the document and other documents, updating the term PRC to DOT, from Public Regulation Commission to the Department of Transportation. As most of y'all know, the oversight of ambulance operations transitioned. Additional changes of course, updating the advanced level agency amounts. And then below that are some updates and modernizations to those standards. And then there was language added for agencies that consecutively fail to apply for funding. And once they do that, if they have been a entity that did not apply several times, then it explains how they have to re-enter the application process to get back into the process of applying year by year. And that goes into a couple of different pages there on the red line version. The page 7 from there beyond had primarily some nomenclature and grammatical things. And then into page 8 on the red line version that I was looking at, you're looking at primarily modernization of language, online references, application availability, those sorts of things. Again, just updating to the current practice, updating the appeal determination process and timeline, and clarifying language for approved expenditures, which now can include reimbursements of volunteer and career folks who spend their own money on certain things, equipment and other things. And then we added community EMS, which at the time of the writing of this rule, that term didn't really exist. And so that has been added to the rule as an approved expenditure. The amount that an entity has to request a carryover for was updated. How some of those things, the budget adjustments process, those were updated, as well as some dates of fiscal reports. From there, there's some modernization of language. And then the updating the percentage of funding allowed for trauma system development went from 4% to 2%. And the other 2% is now allowed to be used for EMS regional work through EMS contract or regional contracts primarily, but can be other types of regional work support, and that is clarified in this rule. And then there's new language clarifying consequences for holding on to EMS fund without requesting a carryover above a certain amount. If you don't request carryover of that amount, you must return that amount. And that is basically state law. And so we made sure that that language here is correct. Real quick, before I go on to the air rule, I know that Rachel Marcus, our EMS Fund Act coordinator, is on. Rachel, anything you wanted to add before I moved on? I'm taking that as a no. So we will indeed move on. Okay. I'm going to pull up the air rule for my own. Okay. Air ambulance. There was a lot of changes to the air rule. As many of the air folks and pretty much everybody else knows, several years ago there was a lawsuit involving the requiring of canes as a requirement for air ambulance. It was very succinctly made clear to us that that is illegal, that a state cannot require canes or any other accreditation by air ambulance. That it exceeds the state's authority of what we can regulate for air ambulance. And so that, and just removing all the references to that alone created a lot of changes and rewrites. So beginning that on page 1, we did want to clarify that out-of-state air ambulance that do deliver patients, while they don't necessarily have to have New Mexico certification to deliver patients here, they do need to have appropriate licensure in their own state. So we just wanted to make sure that that was in rule. It really hadn't been there before. And then again, removing reference to canes. Throughout the document, you'll see deletes of sentences and paragraphs and lists that referenced canes, and that we had to get out of there.
Hey Kyle,
Right. Sure.
Kyle, I'm sorry to interrupt. I noticed that Rachel Marquez had stated that she couldn't seem to get her mute turned off, and I think that's because we have everybody auto muted. So if you'd like to receive some, if you'd like her to speak, I can unmute her from our end. Sure. Just let me know.
If she exhibits any kind of like waving her hand or something, absolutely.
I think that, well, of course, now it's not giving me the option. Perhaps I spoke too soon. She comments, I had nothing to comment there. Okay. Pardon me, carry on.
All right, appreciate it. All right, to page 2 of the air rule on the red line version. Lots of deletions, lots of updates of definitions, including such things as base location, basic life support, clarifying critical care and critical care provider. There have been some excellent discussion and questions and comments that were submitted, that if we incorporate some of those into these changes, they will improve improve. They won't change substantially what we're doing, but they will improve definitions. That also applies to other definitions, specialty care being one, and some other changes and proposals that we have. And first of all, I'd like to thank the air industry in our state for making such fantastic comments and discussions. I appreciate that very much. And again, what we can use to improve our current proposals, we will see if that can't be done. All right, moving on to page 4. You'll see that we just clarified the certification period for air ambulance. We added some language on that page. We're clarifying the requirements for patient care report submissions, PCR, and data requirements. Those were pretty loosey-goosey in the previous version, so we needed to tighten that up, as well as consequences of not submitting data. And then the bottom of page 4 of the red line version into page 5 gets into the level of care that an air ambulance company can apply for, from basic all the way to critical care or specialty care, and who can provide that. And again, any references there to EMT or EMS RN will be taken out and will not appear in versions going forward. Page 5. The major changes here are just line after line of deletion of anything referencing CAMES. And again, at the time, while now there's multiple accreditations, at the time, pretty much CAMES was the only game in town. And so that's why it is referenced so specifically so many times. Also on page 5, there's clarification of special skill need and when that is required. And then sort of an important change is we had cause to work with the Board of Pharmacy and some DEA folks last year, and they made it very clear that if someone has a Board of Pharmacy permit or DEA permit or license, that it needs to be in the name of the air ambulance agency. There have been some areas where that license was in the name of their medical director. I don't think there's many that do that, but it was something that was just sort of accepted. It will not be accepted anymore by Board of Pharmacy and DEA. So we wanted to make sure they had requested this to be added to our rule, and so it was. All right. Page 6, there is the discussion of deemed status. The biggest portion of the changes on page 6 on the red line version. Deemed status is a term that recognizes air services that have recognized accreditation. And again, there's multiple versions now. There's URAMI, there's NAMTA out of Utah. So of course, CAMES is also one of those Bureau-approved accreditations. And if an agency has one of those, we can grant them deemed status, basically that greases the wheels, if you will, for application and certification, and just makes the process simpler and quicker for them. However, of course, if someone doesn't have that accreditation and they would like to apply for certification, New Mexico certification, they can absolutely do that. And if an agency loses their accreditation for whatever reason, it doesn't affect their New Mexico certification, other than they won't be a deemed status entity anymore. Now, I say that it won't affect it unless, of course, it was something major that would affect their New Mexico certification. But if it is something that only affected their accreditation, it doesn't do anything in the way of revoking their New Mexico cert. All right, page 7 and 8 of the red line version. There's mentioned that there were a definition of a base location at the very beginning. This continues assessing base locations, or pardon me, accessing base locations for inspections, inspection checklists, just to make sure that that was clear in the rule. And then towards the bottom of page 7 and into page 8, you'll see that there's updating of the fees for different types of services, different types of renewal, or any of those sorts of things. All of those fees have been updated. Once we get to the bottom of page 8, you get into the enforcement section, and a good portion of the enforcement section is old language, and not a tremendous amount, at least initially, was changed. There were into page 8 and 9, there were some corrections, and of course, deletion of any reference to CAMES. But then towards the bottom of page 9, they're beginning with parenthetical number 11. There is a further list of actions that could result in disciplinary action, and could be a reason for investigation, and again, suspension, or any of those types of disciplinary action. And that list is fairly significant. And then there's also the immediate suspension that was added and discussed, how that would work should there be something egregious enough to necessitate immediate suspension. Most of that was added again because a lot of this referenced CAMES and some of their standards and reasons for decertification. And so we had to create this rather standalone list, and that's why it is as extensive as it is. And then we certainly towards the bottom of page 10 and into page 11, it clarifies the hearing process, the appeals process, how that will work, the notification of contemplated action, and all of those aspects of a investigation, disciplinary action, and a hearing. All of those things, including the cabinet secretary's determination, all of those things are clarified with the new language being proposed. And then the bottom of page 11 on the red line begins how someone would reapply for certification after any kind of voluntary surrender of their certification or revocation or anything like that. So those steps are included now on the bottom of page 11, top of page 12 in the red line version. Further into page 12 and page 13, then this is another area where standards had to be updated, and particularly general standards. Again, most of these specifically referenced the CAMES general standards, and so everything regarding CAMES was deleted, and new lists and new requirements, not necessarily new requirements, but certainly a new list of those general standards were added to just to get those into the rule, since we could not reference an external document anymore. And on many of these, we've had, again, some great comments on how these can be, how these will be monitored and who would monitor them, as well as other very good suggestions for improving the description and enforcement of some of these standards. And again, those public comments will be utilized to improve this list and the determinations and that sort of thing. And again, just wanted to thank the AIR folks for your discussions and your suggestions. Into page 13, yeah, pardon me, 13 and, or pardon me, 14 and beyond. The area on radio comms, communication frequencies was just simplified, just to get rid of some of the confusing numbers and frequency lists, and which I'm not sure has ever been completely correct. And so that was eliminated just to make it a little simpler. And then towards the beginning of page 15, or pardon me, the end of page 14 and beginning of page 15, the application process, the actual application for air ambulance certification. There's multiple deletions of accreditation references, of course. And then there's like pages, a couple of pages there of deletions, again, of accreditation references and numbers. And then page 16, bottom of page 16, the equipment standards list, which again was an externally referenced list, is now included in rule as a standalone list. And it's significant and it's long, and there's 2 or 3 pages there. I don't think there's anything out of the ordinary. A national resource was used to create that list. And again, I think there's been some great comments regarding that. All right. Those are the 3 main rules. And from this point, I'm just going to go over the document and just go through those instead of using a PowerPoint. So if you'll bear with me for just a moment, I'm going to stop sharing for just a sec. All right, and I'll begin sharing again momentarily. Just give me a quick second. All right. The next rule is the advanced directives rule. Now just going to this. Ideally, you're seeing that document, the red line, indeed. Cool, thank you, sir. Although there's lots of deleting lines and that sort of thing, most of that is nomenclature, numbering, grammatical, making sure how the list is alphabetized and all of those sorts of things. There's very few true major changes to the rule. But we just wanted to update a couple of things in particular that I'll get to here in a moment. But there, as you can see, as I'm scrolling down, definition for designee, and was just basically moved again to be alphabetically correct. It looks like new language, but it just appears below. And then some changes and movement of definitions for the bracelet and different things like that. Again, very few major changes to the actual rule itself. Scrolling, scrolling, scrolling. Now, the do not resuscitate order, this was something that was the main goal of the changes made here. And it's a fairly simple but very important change. You can see a deletion there of or by the person's authorized healthcare decision maker in reference to who can revoke or cancel a DNR. And we had included in our rule that the person's authorized healthcare decision maker could do that. Dr. Ben Diven from Las Cruces is the one who found and noticed that conflicted with the Uniform Act End of Life Act. Is that correct, Chris? The Uniform End of Life statute.
I believe that is correct.
And we can't do that. Obviously, we can't conflict with other state law, and we wouldn't want to in that particular case. And so that was removed. And again, I think Dr. Diven was amazing in finding that and making sure that our rule was appropriate. The rest of the changes there you can see are primarily grammatical in nature. And some changes in ordering regarding artificial respiration and that sort of thing. Now, you will also notice when we updated this in 2017, we thought that we had clarified that suicide was not a reason for reversing or, pardon me, canceling or not honoring, if you will, an EMS DNR. And we removed it from a portion of the rule. We missed it in another portion of the rule. So in one portion, it did not list suicide as a reason to not honor a DNR. And in another portion, it still listed it. So we have made that change to assure that those two things agree. And again, that is the second major substantive change that was made to this rule. The rest of things there you can see were primarily grammatical and numbering. And so that's basically it for the advanced directive rule. Last rule is indeed supplemental licensing, affectionately known as the scope of practice rule, but it does obviously address some other things. Beginning at the beginning of the first page there, you can see primarily some numbering changes. As we go down, not a whole lot of things proposed for change here. As we get into the basic scope of practice, there was oral ondansetron that was added for the basic level. And so that is a proposed moving on from the medical direction committee. Some changes in numbering there. The next thing that was proposed here was adding the EMS RN to the ILS scope. Of course, that will be removed, but there were other changes to the ILS scope, including proposing that patients 8 years old and older have the intraosseous access. And then for patients 7 years or younger, that's limited to tibia and distal femur sites. Again, those are part of those changes that were proposed actually a couple of years ago. We're just now getting it done. Endotracheal medication administration was removed, seeing how that's been removed for all levels, paramedic included. So we took it out of intermediate, or was recommended to be taken out. Some changing in numbering. Moving down. The addition of tranexamic acid, TXA, to the ILS level. And if the patient is 15 years or less, calling an MSEP is required. Oxytocin being added to the ILS level. Dextrose, not really added, it was just moved. And then you can see some numbering changes. Again, EMS RN that will be removed. Into paramedic scope. Just an addition for initiation of blood products. You have to have online medical control for patients under the age of 12. Some moving around of approved meds, approved med routes, and the removal of endotracheal. So oral moved up, and then changing some of the other numbering. The addition of haloperidol, droperidol, olanzapine for chemical restraint to the paramedic level was proposed and approved by the Medical Direction Committee. A paragraph here that gives paramedics a little more flexibility in what they can transfer, trying to make a few more common sense level transfers out of particularly rural areas. But hopefully that proposed rule will give us a little more ability to do a few more transfers rather than resorting to other methods that don't make a whole lot of sense. And moving on, one of the big additions here is the addition of Clovis Community College as an approved program. They're not all the way through their approval process. It's rather a temporary approval at this time. But I wanted to include it simply because if we didn't and it got approved, it might be a bit before we could get them back in here. So I took advantage of their temporary approval and went ahead and added them. A couple of changes there for special skills. Primarily updating, submitting to a portal rather than in paper applications, and a few things like that. Some clarification on the semi-annual reporting and how that is done, and some a little bit of clarification on what happens if a skill is not renewed, and how we notify folks if that occurs, and some clarification on the report documents themselves. Down into the special skill application, primarily modification to match the online version of this application now that exists. And so some changes there. Again, there's proposed EMS RN to be removed. And again, and I think that takes us to the end of that. And I believe that is the end of the rules that have proposed changes. So I'm going to mute my mic and take a bit of a break from speaking.
All right. Well, thank you for that very detailed presentation. That was excellent. Before we move on, I'd just like to turn to Mr. Woodward, see if you have any additional comments to make. If not, that's fine.
I guess the only thing that I would say is as we're about to open it up for public comment, we seem to be having some technical difficulties with Teams today. Earlier, it seemed as though I was able to unmute individuals, And now it seems like that option has mysteriously disappeared. So I think the way that we'll do this, there's a feature in Microsoft Teams for meeting settings where we can uh, allow allow everyone on the call to unmute themselves and to turn on their cameras. And so we're going to Stephanie's on the call and she's going to uh, uh, click on that. And so I would just ask, we've got a number of people here on the call today. So I think the way that we'll do this is if you will please raise your hand in Teams. There's a raise hand feature. And if you'll raise your hand in Teams, if you have a public comment that you'd like to offer, we'll go in order of the hands raised. And if you will just please keep your microphone muted until the time comes for until you're called on, basically as we go through, folks. That would be greatly appreciated. I know that when we're having large meetings like this, we can run into difficulties with people keeping their microphones on. So that was all I had to say.
Great. Thank you, Chris. And Stephanie, since you have the capability to unmute people if necessary, will you be calling on those who raise their hand, or do you want me to call as I see them on my screen? Whatever works best for you.
You can go ahead and call on them.
Okay, perfect. All right. Well, with that, if anybody would like to make comment here today, please raise your hand and I will call on you as they appear on my screen. Deborah Walker, you are first.
Can you hear me? Oh, great.
Yes.
Sometimes my computer doesn't work on the audio. I'm Deborah Walker, the Executive Director with the New Mexico Nurses Association, and I wanted to publicly thank the Bureau and DOH for pulling the EMS RN portions of this. NMNA is very committed to have nurses, RNs, and APRNs as providers for this area of practice. And we would welcome the opportunity to work with an interdisciplinary team to ensure that RNs and APRNs comport with the necessary education and training necessary to provide care for patients in this area of practice. And on that note, I will just say again, thank you. We felt very strongly that we were against the dual licensing, and we also are committed to make sure that we've got, given our workforce issues across the state, across multiple provider sectors, we want to make sure that we continue to address what we think was the initial rationale for exploring an EMS RN. But we believe that under the current rules at the Board of Nursing, coupled with discussion from the interagency teams, that we can address additional requisite education and training that would make everyone assured that the RN can be in the back of the ambulance safely and providing quality of care. So thank you very much.
All right. Thank you, Ms. Walker. Benjamin Diven.
Good morning, everybody. Can you hear me okay?
Yes, sir.
Yes.
We can hear you.
I'm the one that initiated the rule change on the advanced directive rule. I thank Kyle for his kind words about me. I stumbled onto it while writing protocols for my paramedics about abiding by the do not resuscitate orders and advanced directives our patients have. It's a confusing area for a lot of them. And this rule that allowed people with power of attorney to revoke a DNR was very confusing to them because we have an excellently worded and written New Mexico Uniform Healthcare Decisions Act, which outlines in detail how these should be addressed. And they do not allow anybody, including somebody with power of attorney, to revoke a DNR. And I thought that the conflict or contradiction of the two needed to be resolved. And I thought it should be resolved in favor of that excellent statute that the state already has. Did that make sense?
Yes, absolutely. Thank you very much.
Thank
Um,
you.
Next, we have Ha Mai.
Mr. Najjar, if I may, so next to the little yellow or orange hands that are up is a number that shows the order that they go in,
Oh,
and I
wow.
think
Okay.
we may have mistakenly skipped over Sheena Ferguson, so I believe Miss Ferguson is next.
I apologize. I don't see a number on mine, so
Oh, okay.
I'm sorry, Miss Ferguson. Go ahead.
Thank you very much for letting me speak here today. Sheena Ferguson, I'm the Executive Director of the New Mexico Board of Nursing and the Executive Officer for the New Mexico Nursing Licensure Compact. We are very grateful to the Bureau for removing the EMS RN language until we can, as a group, meet and discuss how we do all of this without violating any of the rules in the compact, which, as you all know, is in our state law. So I look forward to working with the Bureau and particularly Kyle to look at the language on this. We understand there are needs in the rural parts of the state and look forward to that. The Board of Nursing appreciates the willingness of the Bureau to work with them. Thank you.
Thank you. Ha Mai.
Good morning. Can you guys all hear me?
Yes.
Yeah. Thanks for letting me speak. My name is Maiha. I am actually the chair of the Air Medical Trauma or Transport Advisory Committee. And we did send in, we had several concerns on, or I guess comments on a lot of the air rules. But the main one that we wanted to address was the 7.27.515, the enforcement rule, was that we felt that, any kind of grounds for suspension versus denial of, I guess, functionality in the state shouldn't be relied on by the Regional Trauma Advisory Committee. So we met yesterday and we had talked about creating a performance improvement team itself, and then therefore cases or services that are brought forth can be reviewed by us. And it's going to be, established with multiple various air transport services. That way it's unbiased at this point. That way we can review and we know our industry and we know how we function in the state. And so we would ask that we would place that in the rule that we can be a part of that.
Thank you very much, Ms. Ha.
That's
I don't want to call anyone out of order, but the next person at the top of my screen is Jenna White.
Hi there, can you hear me?
Yes, we can.
Great. Good morning. My name is Jenna White. I am an EMS physician in New Mexico and a member of the New Mexico EMS Medical Direction Committee. And I just wanted to express my personal concerns regarding some of the verbiage surrounding licensing reciprocity, specifically the proposed addition that if an applicant has joined an EMS agency in New Mexico, that the agency's medical director can verify their competency in lieu of taking the Bureau's exam. And I have concerns about this specifically in that this creates the potential for an incredible amount of bias and potentially favoritism. It removes a process of standardization that has been long-standing in the state of New Mexico, and creates an opportunity for considerable variability in the provider skill level that I don't think is an avenue that we should go down. I think the licensing process is one process, and that has been clearly delineated for years in state rule. And the credentialing process, as performed by medical directors, is a separate process. And I think that this proposed rule combines and kind of muddles those. And I am strongly not in favor of that. And just wanted to make that known. Thank you.
Thank you. Jordan Richards.
Thank you. I just wanted to, I'm Jordan Richards. I'm the Director of Clinical Services for AIT AirMed. I just wanted to echo Maya's sentiments on the revision to AirMed. As I stated in the letter that I submitted, there does seem to be a better committee in the AMTAC versus the RETRAC when looking at regionalization versus statewide capabilities, and then some of those intricacies that come with AirMed that should be reviewed by that group. So I just wanted to reiterate that and our stance. Thank you.
Thank you. Scott Maxwell.
Hey, good morning. Thank you for your time. Scott Maxwell, Director of Clinical Services with TransAero Medevac. So I echo Hamai's and Jordan's statements on AMTAC and RETRAC, and I have a statement that's been posted to the website regarding that. I do have a couple of other things to bring up regarding this same rule. On page 4, I'd like to express some concern on the license level of air ambulances where an EMT basic air ambulance is allowed. I believe that's going to delay A, the request for an ambulance, and B, the potential scene time, because if you have an ILS crew on the ground with a patient and they request an ambulance and that air ambulance shows up with 2 EMT basics, that by law cannot happen. So I suggest that we strike the BLS, ALS level, or the BLS air ambulance care. And then page 6, I understand the comments about CAMES and all that. And then we go and we eliminate the words for CAMES. And obviously I'm not a CAMES accredited program, we're an AMTA, but then we go and we list the other 2 and we eliminate CAMES. My suggestion is we either do not list the 2 or we list all 3. And then a couple of more on here. Page 12 on the red line version, where it talks, let me find it here. The frequencies and, or sorry, page 14, the aircraft radio frequencies. It specifically says that fixed wing aircraft will have UHF radios to talk to the hospitals. That's not on board any fixed wing air ambulances, nor is it appropriate. I suggest that is struck because they're going to an airport, getting an ambulance, and then they're able to call via UHF via ambulance. They're not calling directly to the hospital. And that's my comments for now.
Thank you very much. I have Jenna White as a hand still up. Are you wanting to make additional comment, Ms. White?
No, I'll lower my hand. Thank you.
Okay, great. I don't see anybody else. Is there any additional public comment to be made today? All right, seeing no further comments, we will adjourn the hearing. I thank you all for coming today, and thank you for the presentations and the comments. Take care.